Y'all, I've been on the posting mood today. I've just been uploading all of these videos, and it's about to be crazy. You're about to get notifications out the butthole of me. Anyways, so today I'm going to be talking to you about otosclerosis. This is one of my favorite things to say. I just like the way sclerosis rolls off my tongue. And I hope that you enjoy this presentation, and I hope you enjoy all my past ones too. So here's a little info about otosclerosis. It can happen when abnormal bone growth in your middle ear or inner ear interferes with sound's ability to travel. This can lead to mild, moderate, or severe hearing loss. I've actually never heard of the word otosclerosis before until I made this presentation. So I learned all of this, and it was really cool to read about. So I hope y'all learned something from it too. Okay, what is otosclerosis? It is a condition that causes hearing loss. The term auto means of the ear, and sclerosis means abnormal hardening of body tissue. Otosclerosis happens when irregular bone remodeling or growth occurs in the middle ear or, more rarely, your inner ear. Bone remodeling is a lifelong process in which existing bone tissue repeatedly restores itself. In otosclerosis, irregular bone remodeling interferes with sound's ability to travel through your ear. That was a lot to say. Symptoms. The most common symptom of otosclerosis is hearing loss, which happens gradually. People with otosclerosis may notice that they can no longer hear whispering or low-pitched tones or sounds. In most cases, people with otosclerosis have hearing loss in both ears. Approximately 10% to 15% of individuals with otosclerosis have hearing loss in one ear. Other possible otosclerosis symptoms include balance issues, vertigo, ringing in your ears, which is called tinnitus, dizziness, and if you have otosclerosis, you may speak quietly because your voice sounds loud to you. Now, vertigo is different from vitiligo. I used to get these confused all the time. Vertigo is of the picture of the ear with the bell. And vitiligo is like when you lose your skin pigment. My dad has that. Anyways, next is causes. Oh my god. Okay, so deep inside your ear, there are 3 tiny bones, which are called osculars. I don't know if I said that right. That vibrate to amplify the sound waves that pass through them. These sound waves travel to the cochlea in your inner ear, where they convert into signals before moving on to your brain. Otosclerosis most often develops when the stapes bone, a small triangular bone in your middle ear, fuses with the surrounding bone tissue. As a result, sound cannot travel effectively. And that is what the picture is trying to show you. It's the bone and it's growing into the tissue thing. That's why those two things are not supposed to be connected, which is the main problem, or the actual problem. Risks. These are your risk factors, okay? Family history. You're more likely to develop otosclerosis if a parent, sibling, or grandparent has it. Sex. Females are more prone to developing otosclerosis. Race. Overall, white people have higher chance of getting otosclerosis. Pregnancy. People who are already prone to otosclerosis may develop the condition while they're pregnant. Osteogenesis imperfecta, which is also known as OI, also known as brittle bone disease. OI increases your risk of otosclerosis. Otosclerosis predominantly affects Caucasians of European descent. So if you're white and you know that you have, your grandparents were European, you now have high risk. And obviously, brittle bone disease is when your bones break really easily. They're brittle. Tests. So these are some tests that you can take to figure out if you have otosclerosis or whatever. So, if your primary care physician thinks you might have otosclerosis, they'll refer you to an otolaryngologist, ear, nose, and throat specialist. First, they'll rule out other health conditions that share similar symptoms. Next, they'll run hearing tests to determine the extent of hearing loss or intent, whatever. Audiogram, which measures your hearing across a range of frequencies, which is this picture up here on the right. That is the audiogram, and that's just what it looks like. Symphogram, which tells your provider how well your eardrum works. Your healthcare provider may also request a CT, computed tomography scan. This imaging test helps your provider to see the bones and tissues inside your ear in more detail. Here are more pictures. So up on the left is the tomogram, and then the one down below right here is the CTC, or whatever one I did not call out. I don't know. Treatments. Hearing aids amplify the sounds around you to help you hear better. And that is going to be the one at the top, is your hearing aid. I cannot pronounce these words, y'all. Stapedectomy is the medical term for otosclerosis surgery. During this procedure, an otolaryngologist places a prosthesis replacement hearing bone in your middle ear. This bypasses the stapes bone, allowing sound waves to travel to your inner ear. And cochlear implants can improve hearing in people with cochlear otosclerosis. Your cochlea is a spiral fluid-filled structure in your inner ear that helps with hearing. A cochlear implant bypasses your inner ear structures and creates a new pathway on which sounds can travel to your brain. Okay. So here is, on the right is obviously there's the before and after pictures of it. And then on the top right is going to be your hearing aid, and on the bottom is going to be your cochlear implant. Here are your prevention methods. Sadly, there is no way to prevent otosclerosis from developing. It's very sad, but it is so true. Here are some interesting facts about otosclerosis. Ludwig van Beethoven, the renowned composer, theorized to have otosclerosis. Harriet, a Victorian journalist who gradually lost her hearing, with medical historians speculating otosclerosis as a cause. Theresa, an American archaeologist who lost her hearing due to otosclerosis. Margaret Sullivan, an American actress who suffered from congenital otosclerosis, which worsens with age. Howard Hughes, an American avatar engineer and serialist who also had otosclerosis. And Frankie Valli, lead singer of the Four Seasons, who experienced hearing loss due to otosclerosis but had it restored through surgery. I don't think I pronounced any of these names right, but that's okay. Here are the sites that I used, or really just sites. I mainly just used that one. And then thank you so much for listening to me talk to you about otosclerosis, and I really do hope that y'all learned something from this, whether it be I can't pronounce nothing, or you just, maybe your grandparent has it and you never knew, and now you do. Goodbye, y'all.